What's her name? Right, very good afternoon to you. You're listening to 9ja Health Radio, your wellness companion. And well, it's the Clinically Speaking show. And this is the show where we have seasoned health professionals dissect different medical conditions, how they can be prevented, cured, or managed. My name is Temitope Olawumi, and I have with me in the studio today Dr. Yide. Hi, sir. Good afternoon.
Good afternoon. Thank you.
Yeah. So, how was it? How did you get here? Was it very easy with the traffic and all?
It was very traffic leading.
I know, but you managed. You coped.
Yeah.
And you're here now. I was so excited to have you. Well, just so you know, Dr. Olayide Jinadu is the Medical Director and Chief Executive Officer of Med Hospital. And well, Dr. Olayide Jinadu is an experienced healthcare professional with a demonstrated history of working in the medical practice industry. He is skilled in basic emergency, trauma care, and advanced trauma life support, ATLS. He has a strong entrepreneurial acumen with a MBCHB, Bachelor of Medicine, Bachelor of Surgery, focused in medicine and surgery from Obafemi Awolowo University, and some other certifications from the University of Washington, including Project Management in Global Health, Leadership and Management in Healthcare, the Fundamentals of Global Health Research, Clinical Management of HIV, and Policy Development and Advocacy for Global Health. He recently bagged a certification on Understanding Addiction and Identification, Counseling and Treatment of Opioid Use Disorder from Harvard Medical School. Wow, that bio was quite a mouthful. It's a lot. So it's good to have you on the show today.
Good to be here.
And well, today we'll be talking about peptic ulcer disease. And I know that ulcer is one of those diseases that have a lot of myths surrounding it. A lot of people have one or two things to say. Your grandma has one or two things to say about ulcer. You're not eating, and your mommy is saying you better eat, or if not, you just come down with ulcer. So I think it's safe to ask, what is peptic ulcer?
Right. Thank you. Yeah, peptic ulcer is peptic ulcer disease (PUD) is a chronic. When I say chronic, the word means long-standing. Doesn't necessarily mean severe. It's a chronic wound within the lining of the stomach.
Okay.
The first part of the intestine, that's the duodenum. Okay. It's a blanket statement for gastric ulcer and duodenal ulcer. It's a wound that refuses to heal. Wow. Imagine a very stubborn wound on your skin, which refuses to heal and all that. And that's what you have.
Ouch.
Yeah. But this one will eventually heal. Eventually, if you do what you're supposed to do.
Okay.
During the course of this discussion, we'll find out what to do and all that. So it's a wound that refuses to heal. It's chronic, and it's a blanket statement for gastric ulcer and duodenal ulcer.
Okay, so what are the different types of peptic ulcers that we have?
Okay, I just mentioned gastric and duodenal. The word gastric is from gastrum.
Okay.
It's Latin for stomach.
So gastric ulcer, an alternative word for it would be stomach ulcer.
Yep. If you could, yeah, that would fly. That could fly. Then the duodenum, that's duodenal ulcer. The duodenum is the first part of the small intestine.
Okay.
When people say this and understand that stomach, this is not your stomach. It's not your intestines. Your stomach is somewhere here.
Are you serious?
Yeah, right under your heart, under your diaphragm. Yeah, so tapering down to your small intestine. So the first part of your small intestine is called the duodenum.
Okay,
so
duodenum.
So you can have the ulcer in the duodenum or the stomach.
Okay.
All right then.
All right. So, what are the symptoms of how do I know that? Oh, looks like this might be peptic ulcer? What are the symptoms of peptic ulcer?
Oh, good. Now, it can range from the mild ulcer to a more severe one. So for the mild ones, a common symptom is, I will explain it. I'm saying epigastric pain. When you hear the word epigastric pain, don't switch off, please. Now, the epigastrum is the center of your chest. You know, in between, let's say, in between the breast, so to speak. You know, so whenever you feel that gnawing or burning, peppery pain, you know, that sensation that at times moves to the back. You know, that's epigastric pain. That's number one. You know, you feel that very common. You feel that. You could have melena stool. Melena stool means dark color stool. That actually digests the blood. Okay. Depending on how severe it is, you could have frank bleeding from the anus. But that's very rare. Most cases of blood from the anus from lower causes, you know, probably hemorrhoids, something else. You know. Then at times heartburn. These are associated symptoms. Heartburn. You know, feel the heartburn. Then, like I said, depending on how severe the ulcer, the bleeding is.
Okay.
The patient might start to feel symptoms of anemia, you know, dizziness, lightheadedness, you know, and, or whatnot. So the common symptoms are what I just mentioned: epigastric pain, very annoying pain that can be relieved by, you know, food. Now, this relief can differentiate. We can differentiate gastric ulcer from duodenal ulcer just from the relief. Now, if you have pain in the epigastrium that is relieved within 30 minutes, then that's gastric. But if worsen rather, within 30 minutes, you know, and that's after eating. You feel that after eating, you feel that pain, you know, yeah, fine. It's most likely gastric ulcer.
So it worsens. It doesn't get better with food.
No. But if you feel that the pain worsens, meaning after meals, 2 to 3 hours, you know it's a duodenal ulcer. Why? It takes 2 to 3 hours for food to digest in the stomach. So if the food digests and moves to the duodenum and you start to feel the pain, you know that's most likely duodenal ulcer. I see. Yes.
All right, so interesting. So what are the causes of, you know, a peptic ulcer? Because now that you mentioned that when you eat, you know, if it worsens, you know, around the chest area, then you can call it a gastric ulcer, and then when it moves to the duodenum, it becomes a duodenal ulcer. So a lot of people, I guess this is the reason why people have thought that the major cause of ulcer, you know, is food, not eating on time, eating late, eating too much, eating spicy food, and all of that. So what are the causes of ulcer?
Okay, good. Now, for me to really explain what the causes are, you must really understand how it starts.
Okay.
There are two major causes. Number one is a bacterium known as H. pylori.
Okay.
Helicobacter pylori.
Okay.
Then the next one, NSAIDs, use of NSAIDs. NSAIDs are just drugs that are used to relieve pain. They're known as non-steroidal anti-inflammatory drugs. Now, before I really talk in depth about this, I'd like us to just have like a back of your mind what this also really, how it comes to play.
Okay.
Don't forget from your basic biology that the stomach is acidic.
Yes.
Very acidic.
It is.
Yeah. Okay. So now there should be a balance between the acid content in the stomach and the wall protecting or the layer protecting the stomach. Now, if anything increases the amount of acidity in the stomach, it starts to burn the layer.
So it gets to the
it gets to the mucosa, the layer of the stomach. It can burn it and cause a wound there.
Yes.
If something also reduces the protective layer, don't forget there's a protective layer. Okay, imagine your ozone layer. You know, we keep talking about the ozone layer being depleted. So imagine the stomach layer being depleted. No, if that layer is depleted, you're bare to the acid. So that if you understand that, we can now go along with this cause. Now, when you're talking about the cause, let's put in mind that we have outright causes and risk factors.
Okay.
Now, why am I saying that? Now, if you have somebody at the edge of a cliff, if I push the person, I caused the fall.
Yes, you did.
But if I screamed and the guy jumped because of fear, I didn't actually cause the fall, but it was like a risk factor to the fall. You understand that now? So fine, H. pylori is the commonest cause of peptic ulcer. Unlike what people say, I don't eat. You know, when I make the diagnosis of ulcer, the patient looks at me and say, but doctor, I don't skip my meals.
Yes, I eat well.
Very well. So how can I have ulcer? And I have to explain to them that no, it's majorly caused by H. pylori. Close to 60 to 70% of the human population have H. pylori in their digestive system. Okay. So H. pylori is a gram-negative. Well, I don't let me go to spiral checks. That's just what it is. The classification of the bacteria, and it encourages the increase of acid production. So there's exaggerated acid production. Most of the time, they work in synergy with other things, like maybe when you start to use those NSAIDs I mentioned here, then other risk factors that I will mention. But put it in the back of your mind that H. pylori is the major cause. So for you to treat ulcer, peptic ulcer caused by H. pylori, you must eradicate the bacteria.
Wow, okay.
Yeah, so we'll go to that one.
That's not subsequently.
Subsequently. So the next one now, NSAIDs. Number one cause.
So the first one is H. pylori.
Number one cause, H. pylori. The major cause, not fasting. Or not skipping.
Yes.
So the major cause is H. pylori, the bacteria. Okay? Number two, the NSAIDs I spoke about earlier. Non-steroidal anti-inflammatory drugs. Now, who are the people that use these drugs? Majorly women. Why? Young ladies. Why? Menstrual pain.
Yes.
So, and you know the way we abuse drugs in this part of the world.
Yes, you know, the cramp is not reducing. Then you take another.
Yeah.
You know.
So even the lady gets to the about Felvin from her mates in the school. So she starts to use it even on an empty stomach. And now, what NSAIDs do, I won't go all technical on this. What they do is to erode the protective layer. There are prostaglandins in the layer of the stomach that actually prevent you from having ulcer. But when you take NSAIDs, which are actually pain relievers, for a long time on an empty stomach, you know, talk about months to years, you know, it erodes that protective layer, the prostaglandin E, you know, it erodes it and leaves you bare to acid, for the acid to deal with the stomach.
Wow.
Yeah, so that's how NSAIDs happen. Now, what are the other people that are prone to this? People who have probably orthopedic pain. Now, imagine someone that has orthopedic bones, maybe arthritis, probably fracture or something. You know, after whatever management you've given, you want to place them on long-term pain relievers. You know, you will most likely be prone to give them NSAIDs because they work quite well. The likes of diclofenac, ibuprofen, Felvin, indomethacin, the likes, you know, mefenamic acid. Okay. Then who are the other people prone to this as well? Steroids are some other drugs too. People like asthmatic patients or people who have had an organ transplant. You know, when you've had organ transplants, you have to be on steroids for a very long time. Now, when you're on steroids for a very long time, you can also do what NSAIDs do. Yeah. So basically, these are causes. So I'll put them on cause number 2 for peptic ulcer. Okay. Now 3.
Yes, just so that we don't lose track, we have H. pylori, we have NSAIDs.
Yeah. Okay. Then 3. We cannot talk about food.
So food does contribute.
Yes. Okay. Your habits. Yeah. If you are used to skipping meals, of course, if you fast a lot. Now let's talk about fasting because that's quite interesting. You know? You have different kinds of people. People that have fasted for a very long time, they're used to fasting and never come down with ulcer.
Yeah.
That's because they actually fast, unlike hunger strike. You understand how?
What's the difference?
This is the difference now. When you're fasting, you're meant to be distracted from food. You're meant to do something, probably pray or get something. You know, you're distracted from food. But let me tell you something. The moment you start thinking about food, your brain sends signals to your stomach that, man, this dude is ready for food. Okay. Start releasing acid. And now this acid is being released. There's no food to act on. Man, this guy has to act on somebody. So it starts to act on the walls of the stomach. Wow. You understand that now? So that's how hunger strike, you know, or poor feeding habits. You know, when you skip meals very often, you know, probably workaholics, even we doctors do are very
I think I'm guilty.
I can just imagine. So that's number 3 cause. Now number 4, chronic alcoholics, people that take a lot of alcohol. Now let me sound this into a warning. The fact that you take a lot of alcohol doesn't mean you would come down with ulcer. It's a risk factor.
Okay.
Now, imagine someone who has H. pylori, who takes NSAIDs, and now takes a lorry load of alcohol.
Wow.
You know, they are very...
They're so susceptible.
Yes. Cigarette smoking, nicotine, tobacco, yeah, they're also susceptible to these two as well. And now, what I'm talking about now are risk factors.
All right. Oh, yeah.
That's the risk factors. So risk factors now, there are more. That we can talk about your spice.
Whoa, okay, so hold that thought on spice. It's been quite enlightening, and well, it's been a lot to process. So let's go on a short, musical break, and let's just cool down, process all that you've told us about peptic. Also, this is Macy Peters with Take Care of Yourself. Enjoy.
The world won't fall if you're not holding it up. Just take a minute, put your mind on ice. And you try, and you try, and you try it. But the burden is heavy and overgrown. And God knows that we all get tired. It's a long ride when you do it on your own. And I hate how you talk to yourself. It's not weak if you need to be held. So cut off the little slack and roll all your calorie back. My love, take care of yourself. Call your friends, send your ego away now. Don't need to take it all so seriously. You don't get a medal for the last one awake. So rest your eyes and give your baggage to me. So you try and you try and you try it, but the burden is heavy and overgrown. And God knows that we all get tired. It's a long ride when you do it on your own. And I hate how you talk to yourself. It's not weak if you need to be held. So cut off a little slack and roll all your calorie back. My love, take care of yourself. And I hate how you're going through hell, yeah, when you never let anyone else. So cut off the little slack and roll all your calorie back. My love, take care of yourself. Yeah, my love, take care of yourself. All these things we hide behind, let's not do that, you and I. Take a breath, take your time, hold my gaze and we'll be fine. Cause God knows that we all get tired. It's a long night when you do it on your own. And I hate how you talk to yourself. It's not weak if you need to be held. So cut off a little slack and roll all your calorie back. My love, take care of yourself. And I hate how you're going through hell, yeah, when you never let anyone else. So cut off the little slack and roll all your calorie back. My love, take care of yourself. Yeah, my love, take care of yourself. Yeah, my love, take care of yourself.
Please, I just want to beg you that no matter what you're going through in life, no matter how hard it is, I beg you, eat first. Unnecessary, alone. Peace.
Alright, hope you enjoyed that piece. That was Macy Peters with Take Care of Yourself. The song was released in 2019 and was a banger. It was a favorite of mine. My name is Temitope Olawumi, and well, I have been discussing peptic ulcer with Dr. Yide Jinadu. You are listening to Clinically Speaking on 9jahealthradio, your wellness companion. It's been an interesting conversation, and well, before we went on that short musical break, we spoke about ulcers, and well, he differentiated between gastric ulcer, that is the ulcer that affects ulcer of the stomach, and ulcer duodenal ulcer, which affects the, or should I say, ulcer of the duodenum. Yes, and well, he was saying something about spicy food, as a causing ulcer now, and we had to go on a break. So yeah, doctor, continue on that thought.
Yeah, as a risk factor.
Okay, so it's a risk factor, it's not a cause.
Yes, it will work in concert with other causes I mentioned earlier.
Okay.
Yeah. Now, with the spices, when we talk about spices, we talk about pepper.
Yoruba people.
Yeah.
And I love me some peppery food.
Yeah. No, it's not just Yoruba people, it's black people generally. Yeah, we like our
well,
spice.
some tribes might argue. They really like a little bit. Just a little.
Okay.
Alright, yes,
The
so
ginger. I like ginger for a fact because fine, during the COVID-19, I that was last year, I saw a lot of ulcer patients. A lot of people came down with acute exacerbation of ulcer.
yeah, because they believed that ginger could help prevent COVID-19.
Yeah, it did a lot of havoc because we could be very, very funny at times, when we overdo things. Now, I'm not disputing the fact that ginger is not medicinal. Yeah, it might have some medicinal properties, but like every drug, there's a dose. There's a therapeutic dose and there's a lethal dose. Now, most of these people who are using ginger as a lethal dose. Imagine chewing. Why would you have to chew ginger?
Like, there's way you can incorporate it into your pap and some other things and all. Wow.
It's fine. You're just like crushing like 10 tablets of paracetamol and say this headache. Chew. Alright, so ginger is as a risk factor. Spices generally, pepper, ginger. Now, the next one, very oily stuff. By the time you get don't forget I said these are risk factors. They work in concert, they work together, Now when you take a lot of oil, the oil actually irritates the mucosa. It worsens. It's just like you have a wound that is trying to heal and you keep peeling the clots that the eschar has been formed. You keep peeling it, That's what you do when you eat a lot of oily things. So we'll tell you that stop taking oily stew. Your stew doesn't have to swim in a layer of island of oil, and you don't need that.
Tell us.
You don't need to. You don't need fried eggs all the time. And thank God for the new technology of air frying. Yeah, you don't need to fry with oil anymore. You can fry chicken in its fat. You can fry fish in its fat. These are healthier.
The oil.
Yeah, these are healthier options. Now another one again is legumes.
Okay.
Example, beans. They're another wonderful culprit.
Yes, because there are times people eat beans and they'll say, oh, they're feeling this funny heartburn. So it explains it.
It explains it, when you take especially at night when you eat beans. And when I mean beans, I mean all the preparations, be it moi, akara. Akara is another wicked culprit. Why? Because have you seen akara without pepper?
Wow.
I'm using akara without oil.
True.
It's basking in oil, soaked, impregnated in oil. And these are fantastic risk factors to actually encourage ulcer. So we advise that even if you must eat beans or these preparations, take it in the daytime where you're sure it's digested. These things digest quite slowly, okay? Then other ones, another thing again I must know, you don't lie down immediately after eating.
Okay.
yeah. Now, if you lie down, you must have noticed that probably at night when you lie down, you feel this burning sensation in your chest, like heartburn. That's a prelude. Why? Don't forget that the contents of the stomach are acidic.
Yes.
Now, the esophagus, which is just above the stomach, was not designed for acid like the stomach. Okay. So when you lie down and you've eaten a very heavy meal, it's like a reflux coming back up, and you feel that burning sensation. The acid content burns the esophagus. So that's another one. A tremendous amount of stress can actually lead to ulcer. Can be a predisposing factor to ulcer. Yes, fizzy drinks. When I say fizzy drinks, Coke, Fanta, I'm not.
Okay. So let's just stick to carbonated drinks. So that you get it. Yeah. Those drinks. You know them. Yes.
Yeah. Reason is this: if you must have them, open it, let the gas escape, and enjoy your drink.
That is the fun.
Yeah.
So when you tell us to open it, someone like me, it's painful. Because in fact, the fun when you take carbonated drinks, the reason why a good number of us prefer carbonated drinks to fruit juice is because of that gas. The way the gas makes you feel, it's almost addictive.
True. But don't forget, I said these are not causes; these are risk factors. Okay, so these are risk factors. Now, what other risk factors? And I forgot to mention something earlier.
Yeah.
H. pylori. The reason why you must eradicate H. pylori from your system is this: it's been known to be a cause of gastric cancer. Not even gastric, colon cancer as well, because it's
the cancer of the intestine.
Yeah, the large intestine to be specific.
Wow.
Colon, when you say colon. So that's for that.
Wow. So this explains why studies have shown that the overall prevalence of PUD, that's peptic ulcer disease, in Nigeria is 28%. So with all of these, risk factors that you've given, it really shows that some of the things that we eat, have been predisposing us, to peptic ulcer. All right. So, Doctor, you mentioned something earlier when you were telling us the types of peptic ulcers that we have, and you said something about the gastric ulcer and the duodenum ulcer. Yeah. So, what I want to believe that there must be a connection somewhere. So, where does that connection lie?
Okay, between the gastric ulcer and the peptic ulcer.
Yes.
Yeah. Fine. Don't forget that it's all in the digestive system.
Yes.
We have the stomach, we have the esophagus, we have the mouth. From the mouth to the esophagus.
Yes. To
the stomach, to the duodenum.
Yes.
Yeah. To the small intestines, the large intestine, and how it goes to the anus. Okay. Now, don't forget that I said earlier that the content of the food you just eaten is acidic, especially when it gets to the stomach.
Yes.
Now, when it takes 2 to 3 hours for this food to digest. Now, once those predisposing factors or those things that have caused ulcer, that can cause ulcer, are present, they can erode the stomach, and not just the stomach, the duodenum as well.
So that's the connection.
Yes, you can have someone that has both duodenal and gastric ulcer.
Ouch! That would be so painful.
Yeah, 2 for the price of 1. Yeah, you can have that. There are other diagnoses, other things that could be more worrisome than gastric ulcer or duodenal ulcer, but that's not for the scope of this discussion. So.
All right. So, what are the complications that could arise, due to peptic ulcer?
Okay, good question. Now, you could have torrential bleeding. It could be very scary. Okay, let me.
Torrential bleeding?
Torrential. Let's talk about a lot of bleeding, massive amount of bleeding from the mouth.
A lot of blood.
Yes, from the mouth. Imagine the person just vomiting blood. Like I had.
So ulcer can cause that.
Yeah.
No, most people when they see if someone has them for you are vomiting blood, village people. So some people believe that it's something diabolical. So ulcer can cause that.
Let me give you a case study of a patient I saw once. An elderly man, a known bricklayer, who has been using Alabu, the NSAIDs I was talking about, non-steroidal anti-inflammatory drugs, a lot of them, like ibuprofen. He discovered that it helps him a lot, especially for pain. After carrying a lot of heavy stuff. So he's been using this. He smokes a lot. He drinks a lot. So these things actually replace the desire for food.
Yes.
So he was rushed into the hospital that day, vomiting blood.
Oh my goodness.
And the people around didn't understand what was happening. They didn't know.
They probably thought it was diabolical.
Yeah, obviously now. People now.
Yes.
Funny.
Yeah, something like that.
So that's a case. That's one. Now at times, obviously for him to have that, it was at the upper part of the stomach. That's upper GI bleeding. Now another thing that can cause that bleeding is malnourishment. When you drink a lot of alcohol and you're wrenching, you vomit. So let me say that. So you don't see that, okay, everybody that vomits blood has peptic ulcer. I've not said that. I'm just saying that's one of the complications. You have to the complication.
Yes.
Another one again is hematochezia, stooling blood, frank blood. I mentioned Melanoma stool earlier. Melanoma stool is dark colored stool, meaning the person is bleeding. There's a wound within the stomach. The body is digesting it along with the food.
Okay, so it just makes it.
So it comes out as black. Yeah, melanoma, very sticky, very foul, putrid smell. Okay.
Wow.
Yeah. So another one is the hematochezia, like I mentioned earlier, meaning the bleeding is so torrential, is so much at the lower part of the stomach, or even probably the duodenum. And the patient, there is no time for the body to even digest it. It just comes out as frank blood. So these are now complications, more complications, anemia. Now the person is losing blood. If you don't replace that blood that is being lost, this person might die of anemic heart failure. Unexplained weight loss. It can lead to depression. These are complications. A person that doesn't agree with the diagnosis of ulcer doesn't go to the hospital, or has been going to the hospital, has been receiving drugs, but has not been very compliant with this drug, and there's depression there. That can be a complication. You understand? So it's not something that we just treat with kid gloves.
Yes.
Yeah.
No, it isn't. It isn't. Apparently, it's something that should be treated with urgency. All right, so we might not be able to delve into this question before we enjoy a little music because what you said about anemia, really, really got to me. Okay, so how can peptic ulcer be completely cured? First off, is it possible for it to be completely cured? And if so, how can it be?
Very possible, yeah, it can be very possible, yeah. Remember I said that there are many different causes. So if you've delineated, if you've been able to pinpoint that, okay, this is what is causing this, fine. If you eradicate H. pylori, the person gets fine.
All right, so we'll come back to how it can be cured after this short musical break. Let's enjoy this one from Cobams, and it's an interesting one. I love it. We go win.
Corona, no big pass us. We go fight time, we go win. As long as we remember to always do the right thing. Wash your hands, love each other, we go win. Oh. Corona, na the virus, when we walk in, you no get let go, but you get waka from person to person. But we fit beat time, we fit stop am, if we maintain good hygiene and practice social distancing. We go win. No shaking hands with your neighbor. Love them and kiss from afar. Use soap and water to wage war. Let's show this thing who we are. We are special, we're courageous, we are awesome human beings. We do super, we get power, we can conquer anything. If we hear word and obey laws and exercise discipline, wash your hands, love each other, we go, we know. If it be like say you know well, like it's something they do, and you think say you believe say he get a seed to you, and your body no researching like it's something they do. No let panic finish you, you go we know. Self-isolate for the sake of all the people that you love. Don't go around spreading rumors, 'cause fake news won't help anyone. You are special, you're courageous, you're a caged human being. You too much, oh, you get power, you can conquer anything. Only if you hear word and obey laws and exercise discipline. Wash your hands, love one another, we go, we know. My brother, my sister, papa, mama, and begin. COVID-19, no because we go fight and we go win. Just as long as we remember to always do the right thing. Wash your hands, love each other, we go, we know.
That does not have foresight, that lacks vision, that babe that cannot see tomorrow, that rejected you, dumped you, because today you are poor, you are lazy, you are broke. Guess what? That same girl, tomorrow, she will not regret it. She will not suffer later in life for doing what she did. She's going to find the love of her life, and they will get married, give birth to children, and live happily ever after. The Hollywood movie you are watching is too much. Go and walk.
Alright, we hope that one from MC Relax made you laugh. And you listened to We Go Win by Cobams Asoko right before that, small skit. And Cobams released that one in 2020, March 2020 to be precise, when we're all going through that first wave of COVID-19. Yes, and it was quite comforting. Okay, you're still listening to 9ja Health Radio, your wellness companion. This is the Clinically Speaking show. My name is Temitope Olawumi, and I have been in the studio with Dr. Yide. we have been speaking on peptic ulcer, and it's been most enlightening. We've learned so much. So right before that break, we were talking about if peptic ulcer can be cured, and you said it's possible if you're able to eradicate H. pylori. What can be done to get peptic ulcer cured?
Okay. Yeah, thank you very much. Like I said earlier, once you know what's actually causing this particular ulcer in this patient, you ensure you eradicate it. Like I said earlier, if it's H. pylori causing the person's peptic ulcer disease, try to eradicate. Be sure you eradicate it. After treatments, you do the test again to ensure that you don't find the person is H. pylori free.
Okay.
Now, if the person's ulcer is caused by the NSAIDs, use of NSAIDs, you advise them not to use NSAIDs anymore. Now, let me say this too. Not just NSAIDs, even there are some anticoagulants, some drugs that prevent blood clots here and there. You know, this is usually used in the elderly. That need it. Okay. Now, most of them are low dose aspirin.
Okay.
You must use it with caution. Don't use it on an empty stomach. Just the same way you have these things with NSAID. So if you can avoid NSAID use, if you can avoid it, like all these drugs and all that, yes, you can get cured. If you can also avoid all those risk factors I made mention of earlier, yeah, sure, it can be cured. But I'd like to also throw back that question, just like a wound. Imagine you having a wound here. Now, the fact that the wound has healed, are you immune to other wounds? No. Just avoid trauma. So if you avoid these things, you do quite fine. Because some of these ulcers can be quite stubborn. The therapy can take 6 months, can take a very long time, especially for people who don't really adhere to these do's and don'ts.
Wow, interesting. Okay, so I think you've also answered an unasked question about preventive measures. So preventive measures includes don't take NSAIDs perhaps without take them with care. Don't take them on empty stomachs. And if you're going to use certain medications, you should get doctor's prescription. I believe that a medical practitioner, your healthcare provider, will tell you the specific doses of drugs that you should take, even when they're giving you a prescription, so that you don't expose yourself or predispose yourself to peptic ulcer. So at what age can one, is there a particular age at which you get predisposed or you are likely to have peptic ulcer? Yeah,
I like that question. Because fine, things change. There's this adage we used to say, never say never in medicine. If anybody tells me now that I can find ulcer in the baby, I won't be shocked.
Are you serious?
We're talking about H. pylori here. Now let me tell you how we in Nigeria, how we infect our children with H. pylori. A lot of our mothers feel their mouth is the cooler. Now, the food you're giving the child is hot, so you first put it in your own mouth before you put it in the child's mouth.
Yeah,
that's so gross.
Very gross.
Forget that you're the mother and all that. If you had H. pylori, you just infected your child.
Oh, so wow. So H. pylori is transferable.
Yes. Okay. It will take me to something. We used to think that there was a strong genetic predisposition, but we've come to discover that the genetic predisposition is not as strong as we used to think. It's majorly H. pylori. Now, when you see a mother, a daughter, a father, you see peptic ulcer in the family. That's so it did for our family. Everybody get that for our family. Then you now start thinking that it's most likely H. pylori. They've been transferring to themselves unknowingly. So that.
Wow, interesting. So about the age, is there?
For now, it's we'll say from 5.
Okay.
Because I've seen a 5-year-old come down with peptic ulcer. Yeah, but I won't be shocked if I get in a younger child. But it'd just be more difficult to make diagnosis of. You might not really get that complaint of epigastric pain from a child.
Yeah, it's because they can't even talk.
Yeah, the child complains and I just have a tummy. Every time goes restless and all that. So you to take a very good doctor, someone with a very high index of suspicion, who thinks that never say never, to make such a diagnosis.
Also, it's possible then that possible. A baby can also be diagnosed of peptic ulcer.
Yeah, not very. For a baby, it's possible. Yeah, it's possible. Never say never, but very rare because we advocate for exclusive breastfeeding for 6 months. Okay, so and baby It only take a mother without discretion who keeps putting the feeding bottle in her own mouth or the spoon in her own mouth.
No, mothers should even stop doing that, really. But wait, but before the mothers come for me, so I understand why they do that. You don't want to put too peppery food into the child's mouth or a food with high temperature into the child's mouth so that it doesn't burn them. So how can mothers,
Just stop it.
what are
There's
the
no
alternatives?
sentiment. There's no sentiment. They just to stop doing that. You have your own spoon.
But the bond. There's a bond between mother and child. So if I eat and the child eats,
Let me see what I'm going to say now, please. Okay, when you breastfeed your baby, do you taste your breast?
It's true.
Please, no.
Okay.
There's no sentiment involved.
Okay, but for mothers that are probably listening to this, what alternatives? The truth is, you know the way we are in Africa. We just want to be sure that what we're giving our baby, is safe for them.
Okay. Let's be very. Let's all get ourselves tested for H. pylori.
Okay.
Yeah, let's get ourselves
so we
tested.
can do that.
Yeah, you can do that. It's a very common test, H. pylori. Then urea breath test, the other stuff. Because if I tell you to go for the upper GI endoscopy, which is very expensive, so people will come for my head.
Okay.
So you can just get yourself tested for H. pylori. If you have it, eradicate it. You might not even be coming down with symptoms, but if you have it, eradicate
Also,
it.
it's possible for you to have H. pylori and not even being
If you don't forget, I said most of these things work in concert. Now imagine if you've had H. pylori, but you've not given the H. pylori some
triggers.
Some triggers, some opportunity to actually work. You don't abuse NSAIDs, you don't take food the way you take food.
Don't take too much of spicy food.
Yeah. So you might not come down with peptic ulcer. Yeah.
Alright, so one of the popular myths around curing peptic ulcer is taking a lot of milk. How true is this?
If you had peptic ulcer due to H. pylori, you have just encouraged the H. pylori to grow. They will pray for you. The ulcer will increase with the milk.
But there are lots of people who do this.
Ask them. Now, if the we tend to, fine, when you take mixed mag or an antacid, which is a treatment, so to speak, for ulcers,
yes.
They tend to think that if mixed mag can do it, normal milk should do it. If the peptic ulcer is caused by H. pylori is a bacteria. Okay. Milk will always encourage the growth of any bacteria.
Oh, so
Yeah, so you're just feeding the peptic ulcer if it's caused by H. pylori. But if it's not, it might be palliative but doesn't treat. It has no form of treatment. It might be palliative. It's just like you have wounds now and you put maybe GV on the wound and all that. It's not really doing much, but at least it helps the pain.
I think it's just safe to say that if you're experiencing any of the symptoms mentioned, just go to the hospital and get yourself tested. Don't try funny stuff in a bid to treat yourself. All right. So are there regions perhaps in Nigeria that are prone to peptic ulcer rather?
Well, I wouldn't say that. Everybody, it's an equal thing. But we made mention of something earlier that Yorubas we like a lot of pepper.
Yes.
I won't say the Yorubas are more, because you have it in the Igbos, you have it in the Hausas, you have everybody having peptic ulcer. So I won't say there's a particular region. It's equally distributed. Because there are many other causes of peptic ulcer. Okay.
Oh, quite interesting. I've really learned a lot from this. So not like we're a recycling question or anything, but just show that those that are listening, you've mentioned that alcoholics are prone to yes, and all that. So just in order to be specific, who are those apart from those that consume a lot of alcohol and smoke a lot? Who are those that are likely to have peptic ulcer, so they know that this thing you're doing
young ladies who have who use NSAIDs indiscriminately, Felvin. You have a lot of,
particularly for menstrual cramps.
Yes, for menstrual cramps. Yeah, Felvin. Yes. People who take a lot of alcohol. Yeah, especially binge drinkers. People who smoke a lot. Yeah, smoke. Yeah, like anything you smoke, you are predisposed to it.
Even shisha.
Whatever. Yeah. Then people who take a lot of oily stuff. Acidic fruits. How do you know something is acidic? It has a sour taste.
Good question.
You know, there are people that like the unripe. Is the unripe mango? They say no, and that one they get plenty.
I like unripe mangoes.
Unripe, you're dealing with yourself because there's a lot of acid in it. You know, you're
Just
encouraging.
has this tingy, this tingy taste, or is it tangy taste? Yeah,
Yeah,
this
it will
tangy
give you the
taste.
same tingy taste and tangy taste in your stomach by the time you come down with peptic ulcer.
Oh my goodness, that's so brutal. Yeah, I should put that in. Well, can you give us some other, acidic fruits?
Pineapples, my favorite. Yeah, I can tear your stomach. Yeah.
Are you serious?
Yeah,
Wow.
ripe pineapples. It's acid. You talk about acid. Vitamin C. Sorry.
Citrus.
Another name for vitamin C is ascorbic acid. Now, the citruses, oranges, limes, lemon, grapes, they all are tangerines. They all have ascorbic acid. Okay, so they're good candidates for.
Okay, so I know a lot of people are interested, on this particular one, the foods that cause, that are likely to that could predispose you to peptic ulcer. But before we continue on that food, let's go on a short musical break. This is Timmy Dakolo with Matsim. My favorite, any day, anytime. Enjoy.
I get sick when I'm far away from you for so long. I lose sleep when I can't get you on the phone. And this killing me, baby. Oh, I'm missing you, baby. Please don't stay away. I need you every day. What we share, it is so right, it can be more. Come home, please, baby. Let's kiss and talk all night. Cause I'm missing you, baby. And it's killing me, baby. Please don't stay away. I need you every day. Baby, oh baby, you're like medicine to me. Give me everything I need. Baby, oh baby, you're like medicine to me. Give me everything I need. My heart beats every time we fight and you wear a crown. And I smile every single time you come around. Can't do without you. I lose my whole world around you. Please don't go away. I need you every day. Oh, your words, they have a way to steal my heart. And your smile is the medicine that cures my doubt. Oh, my beautiful baby, wrap your loving around me. Please don't stay away. I need you every day. Baby, oh baby, you're like medicine to me. Give me everything I need. Baby, oh baby, you're like medicine to me. Give me everything I need. Baby, oh baby, you're like medicine to me. Give me everything I need. Baby, oh baby, you're like medicine to me. Give me everything I need. Baby, oh baby, you're like medicine to me. Give me everything I need. Sweetie, oh baby, medicine to me. Give me everything I need. Yeah. Baby, oh baby, you're like medicine, medicine, medicine to me. Give me everything I need. Baby, oh baby, without you, medicine to me. You give me everything I want.
Timidakolo with. Alright, that was Timidakolo with medicine, and well, just so you know, if you're having peptic ulcer, it's not baby, it's not baby or baby that would get you cured. Or that I'm just saying. Alright, so Timidakolo released that in 2017, and for me that song is evergreen. Every time I listen, it's like it got released just last year or this year. I hope you enjoyed it. You're still listening to 9ja Health Radio, your wellness companion. This is the Clinically Speaking show. And well, we've been talking about peptic ulcer. My name is Temitope Olawumi, and well, I've been discussing this with a seasoned health professional, and that is Dr. Yide. It's been quite interesting. Before we went on that break, we were talking about certain foods that could predispose you to peptic ulcer, or should I say, too much of them could predispose you to peptic ulcer. And he was talking about our favorite pineapple, and citruses. Yeah, so any more foods?
Now, when I said that earlier, I was talking about people who already have peptic ulcer.
Okay. Oh,
yes,
so
yes, not just an eye. You can't take citruses from me.
Okay, but
if you already have it.
But the intake, if you take too much of the citruses, couldn't it predispose you?
No.
Okay,
no,
nice.
I've not said that. No, I've not said that. What I've said is, when you have, I said these things work in concert. They work together.
Okay.
Once you have all these factors, you have H. pylori, you have all this. It will worsen. It will prolong the healing process.
Okay.
Imagine you having a wound on your hand and you keep pouring probably pepper on it. And you keep feeling pain on it. You know? Now, some habits will ensure that you have peptic ulcer for sure. And now the habits I'm saying, taking unripe ones. Now, if you take unripe orange and ripe orange,
okay,
it is more acidic. It has a more sour taste when it's unripe. You know that, yeah.
Too?
Even unripe mangoes, you know now.
I know about ripe mangoes,
or agbalumo.
What?
Yeah.
No, don't say that one. Don't allow that one. So many people will be heartbroken. Yeah. All right. So Temita Lodi, we have a question here. Temita Lodi is asking that what are the daily lifestyle habits that could help prevent peptic ulcer disease?
Oh, fine. There's this adage that says eat breakfast like a king.
Yes, eat breakfast like a king.
Yeah.
Lunch like I know it's dinner like a beggar.
Like a pauper, yeah.
Oh, like pauper, yeah.
I think it's lunch like a priest or thereabout.
Okay.
But you get the idea. Eat very well.
Okay.
Eat very well in the morning. Eat also well in the afternoon. They're very light at night, so that you don't have so much in your stomach. You don't struggle with digestion, because by the time you sleep, your digestive system literally sleeps as well.
Okay.
So there's this limited metabolism. There's limited activity at that point in time. So if you just eating a large amount of food, you'll meet it when you wake up. A lot of them. There's no digestion, just goes slowly. If it should take 2 to 3 hours, it might take way longer than that. Okay, so basically that's it. Okay.
Alright, doctor. So it's time for a little fun. I've learned so much. So much, and I won't be taking so much of unripe mangoes anymore. I'm so heartbroken because
fufu as well.
No, wait. We have people in this office, that will come for it because we love fufu. I love fufu. I'm proper Yoruba girl. Particularly vegetable soup.
But if you have the peptic ulcer already and you're having
so it's already.
Yes, you're having it already.
What if I don't?
No, you enjoy, have fun.
But no, you said something about people going to test for H. pylori. Yeah. So it means that whether you have it or not, if you're having heartburn, you get heartburns regularly and all of that, you should actually go check for H. pylori, so that you're not consuming so much fufu or ripe mangoes, and then you're just predisposing yourself or making it harder for the ulcer to heal. Yeah, so I said something about fun earlier. Yeah, so there's something we would be doing. It's called the alternatives. And doctor, I know that doctors like to take their time with things, because you want to be careful and pay attention to details. But you cannot think too hard about these questions. You just answer them the way I ask them, as quick as possible. So, rice or spaghetti?
Rice.
Tea or coffee? Coffee. Sandal or shoe?
Shoe.
Native or corporate wear?
Corporate wear.
Rock or R&B?
Give me gospel. R&B gospel.
Okay, croaker or catfish?
Catfish,
No, does not cause ulcer. Okay. It's been such an interesting time with you. Any last word, doctor, before we bring it to a wrap?
Yeah, I'll just say, instead of getting scared about these things, try to listen to all the things we said could actually predispose you to these things, to peptic ulcer, and avoid them. Simple as that.
All right. Perhaps you joined in, well into the show and you couldn't catch some things. Go on our social media platform on Instagram at 9jahealthradio, on Facebook as well at 9jahealthradio. The live show will be there for you to re-listen to. Yes, so you've not missed so much. And if you have questions, drop your question. That we'll make sure to contact Dr. Yide Jinadu. Alright, it's been an amazing time on the show today. Just in case you're tuning in, you're just tuning in rather. You're listening to 9ja Health Radio, your wellness companion. This is the Clinically Speaking show, and my name is Temitope Olawumi. I have been in the studio with Dr. Yide Jinadu, the medical director and chief executive officer of Caris Med Hospital, and he's given us so much. He's taught us so much, about peptic ulcer. All right, we've dotted all our I's and crossed our T's. You've heard it. Please do go into a hospital, get yourself checked and tested for H. pylori. With that, we'll draw the curtain on the show today. We have some more interesting content coming up for you on 9ja Health Radio. For now, we'll say bye.
Bye. Thank you very much.
The attention of the Lagos State government has been drawn to the unprofessional practices of some healthcare facilities in the state who engage in quackery and other vices. These unethical practices could compromise the health status of patients and undermine the huge investment of government in qualitative healthcare delivery. Hence, any health